And joining us now to talk about your health is Dr. Thomas Chin, pediatric cardiologist, co-director of the University of Maryland Children's Hospital's Heart Program and professor of pediatrics at the University of Maryland School of Medicine. Doctor, thank you for joining us. Everyone can see from your shirt that you're involved in the Upbeat Hearts Camp, which is a great name. Tell us about this camp.
Yes, thank you for inviting me to join your session today. Upbeat Hearts Camp is a summer camp for children with congenital heart defects. In other words, children who were born with defects in their heart and who have had open heart surgery and are survivors. So this camp was instituted not so much to determine what the children are unable to do, but what their actual capabilities are.
You were telling me that a similar camp was created at your previous institution up in Pennsylvania. How did it get started? What was the initial goal?
Yes, thank you. So at Penn State Hershey Medical Center, I was approached by a husband and wife team who had unfortunately lost a child with cardiomyopathy. And in answer to how they could donate funds that best would be used by our institution, I suggested potentially opening up a summer camp for children with congenital defects so that many of them who had never attended a camp before could essentially enjoy those things that other children are able to enjoy throughout their own summers. And there was a dual purpose to the camp in the sense of not only could they enjoy themselves during the summertime, but we also had an opportunity to teach them about their hearts. And so they could learn about things like CPR, healthy diets, and even the structure of a normal heart.
How would you say the camps are the same or different than other summer camps?
Yes. So in other summer camps, people are often motivated, in terms of being as active as they could be. And the thing that's surprising about children with the heart defects is how normal they can be. So we take care of children that are very sick. Some patients have cardiomyopathies, which is a muscle weakness of the heart. Others have a single pumping chamber in their heart and have to live on that through their entire life. But people who have heart defects, they typically will push themselves as hard as they can, and then they'll reach a certain point where they just can't push themselves anymore. And then they hit their wall, they rest, and then they go on again. And so, particularly since many of these children have not had this type of opportunity, it's not a lack of motivation, but just what their physical endurance will tolerate.
You mentioned that most of these young people have had surgery, serious, difficult operation. What sort of improvements are possible with modern surgical techniques?
So, thank you for asking that question. Congenital heart disease and surgical repair of these defects is one of the modern marvels and wonders. So as recently as 60, 70 years ago, there was no ability to help these children. Many of them would just die in the newborn period. Currently, 85 to 90% of people born with congenital heart disease will survive into adulthood. And so, in fact, about 15, 20 years ago, the number of children with congenital heart defects has been surpassed by the number of surviving adults with congenital heart defects. So many of these children, as I was alluding to, if you were to see them in their camp and doing their day-to-day, activities, you may not be able to tell any difference between these children and other children that are normal.
Which is an inspiration, and you also include family members in the camp as well, which I'm guessing would include siblings without these issues.
That's right. And I think we've all come to realize that chronic um, abnormalities, including congenital heart disease, are illnesses that affect the entire family. So having a child that's born with a chronic illness um, influences how the family treats themselves, treats the rest of their family, not to mention just the financial burdens and frequent doctor's visits. And so not only the patient, but then the entire family is affected by this disease. So I started something new when I started this camp in the state of Maryland about 2 years ago, in that we included a minimum of one parent or guardian, and then, in fact, also invited some of their siblings to attend, because they, again, are also affected by having a sibling that's chronically ill.
What would you say your future goals are for Upbeat Hearts? I can't say enough how much I like that name.
Thank you. When I started this, the intention was to determine what the children's individual capability is. So not to focus on their limitations, but on what they could accomplish and how close to being normal as they could be. The children and their activities are supervised 24/7 by physicians and nurses in cardiology. So it's been a 100% safe event for these children to date. And so maintaining that degree of safety, allowing them to participate in active summer activities such as swimming, zip lines, also archery and hiking. Those are wonderful experiences that every child has during the summer, and that, these children shouldn't be neglected of that if at all possible. What I'd like to do is also to provide appropriate training so that they, learn the CPR, learn about heart rhythm problems, learn about a healthy diet. One of the children who participated in the camp a few years ago completed the hands-only CPR and came up to me and said, "Dr. Chin, I'm now able to save my parents if they have a heart attack." And so they really take ownership, and they're very proud of what they accomplish.
You mentioned the miraculous surgical advances, and I'm guessing some of these conditions are spotted extremely early in the life of a newborn. Are there other conditions, though, that you want parents to be aware of, difficulties that a young child might have, and obviously the importance of regular checkups where a pediatrician could pick something up?
Yes. So the face of congenital heart disease has changed over the past couple of decades. And it used to be that children with congenital heart defects were detected largely in the newborn period. So somebody who was born in the nursery, their color would be off, their oxygen levels would be low, they might be breathing hard or fast, they might have trouble growing or gaining weight. But now almost all of the heart defects are detected during pregnancy. So the prenatal evaluations are where we frequently will detect these serious heart defects. And so this is something that makes it even more important that women have prenatal care and to identify this thing so that we can make the best of a bad situation if necessary. Now, in terms of afterbirth, if a child has not been known to have heart defects, then those things that I described, such as bluish discoloration, exercise intolerance, failure to gain weight and grow, breathing hard and fast, those may be things that would give you a tip that your child might have a heart defect.
Doctor, if anybody watching wants to support the Upbeat Hearts camp or learn more about it, where can they get more information?
Yeah. So this has been something that's been wonderful, is the community support that we've received, as well as the support from our own institution, the University of Maryland Children's Hospital. And the way that they could support us, actually just contacting us at our pediatric cardiology intake line. I could provide you with that number if you'd like. It's area code 410-328-4348. And we have a website that we could provide you with the how to log in and get further information on the camp, as well as how potential campers might be able to sign up for future years and for volunteers that want to participate. And if they call our number, we can provide you with that information.
Dr. Thomas Chin joining us from the University of Maryland Children's Hospital. Doctor, a pleasure speaking with you. Thank you, sir.
Yes, thank you very much.